afternoon, everybody. Uh, we're going to talk about getting your child ready for a heart operation. So, I am Rajesh Sharma. I am a surgeon who does children's heart surgery, and I am located at Apollo Hospital, New Delhi. And this is a topic that is a very important topic because it is a very sensitive topic. It involves parents, it involves the patient, which is the child who's going to undergo a procedure related to the heart. And as you know, everybody knows that the heart is a very important organ. And the survival of the body depends on the well being of the heart. So, the surgeon, the parents, the whole operating team, and the probably the child too, if he is grown up enough, understands the importance of this situation. So, coming to the point, getting the child ready for getting your child ready for an operation involving the heart. There are obviously two parties involved in this. One is the parent, and one is the child. So the parents need to be convinced, first of all, regarding the importance of the operation, regarding the role that the operation is going to play in improving the life of the child, and what is the time frame in which the operation needs to be done. And once the parents are convinced that the procedure is important, the next thing they want to be sure about is where to get this procedure done. And that obviously depends on where they have been referred to and where the child has been seen and what information they've gathered about a particular center and the people who are going to be attending, the surgeon, the cardiologist who are going to look after the baby. So the selection of the center is a very important thing, which the parents have to have to decide. Now, once the parents are decided regarding the importance of the operation, the role of the operation in the child's life, and the center where they're going to get it from, then we come to the child. So the child is the focus of the entire exercise, and the child may belong to any age group. He may be a neonate, he may be neonate means less than 1 month of age. And in that case, it's a relatively urgent procedure, and that is why it is being done so early in life. Or it could be the child could be up to about a year of age, which is what we call an infant. It could be up to the preschool age group, which could be about 4 to 5 years of age, or he could be older than that, and that is when they actually start understanding in the school-going age group or later on in adolescence that really that something is going to be done to them, and then the various emotions etc. start coming to play if the child is really a grown-up child. So each of these situations has to be handled differently by both the parent and by the surgeon and the cardiologist, the treating team, and how to involve the child in this whole process. So if the child is very young, obviously it is basically you have to, in the preparation leading up to the operation, you have to decide whether the child is medically fit for the procedure or not. So if you are undergoing a heart procedure, which is basically elective, which is not an emergency procedure, you need to have the child in an ideal situation medically. So there should not be any infection, underlying infection. So, or there should not be any cold or anything like that, which makes him unsuitable for the operation. So we rule out all these basic things. You do blood tests, you do an X-ray, you examine the child to see if there's any kind of infection which is brewing. If so, then we postpone the procedure. If not, then we clear the child for the procedure and we go go to the next stage. If the child is a bigger child, like maybe in the preschool age group or the 5 years, 4 to 5 years age group, At that time, they have consciousness, so they are aware of the fact that they're going to get, that something is going to be done, that they come to a hospital for a test. And basically at this age you can still tell them that it's a procedure, it's a test or something which is, and things can be taken in the form of a play, and the parents and the family can enact it like a kind of a playful kind of exercise in which the child also participates, having explained to them that certain tubes will be there. Once the procedure is once the procedure is going to be started, you can explain to them that there will be a balloon which they have to inflate, and those are basically the gases which, when they go inside, the child falls asleep, and then this anesthesia takes over. And obviously the operation is when done when they are asleep, completely asleep and unaware. And when they wake up from the operation, you can tell them that the parents will be around, and some people who are known to them will be around and will be there. And basically you take them, you don't have to explain all details to them. The real issue comes when the child is grown up, and he understands that he has to undergo a kind of procedure. And there it is in general better to involve the child who is going to be undergoing the procedure in the entire process. For example, when you're explaining the procedure to the parent, it is better to have the child in the room, so that he also understands. And the bigger the child, the more the child's involvement and the level of explaining that you can do to the child. And if he's really grown up, you can actually explain the whole procedure, that the thing is being done to make you normal. So today you're not able to walk up a certain number of flights of stairs. You get tired, you get breathless. When you run, you're not able to run equal to your colleagues, and you get tired. So and after the procedure you will become much more normal. You'll probably be able to beat them also. You will not be breathless anymore, you will not be turning blue. This blue color will disappear, you'll become pink like everybody else. So the gain can supersede the anxiety in a grown-up child, and they can be convinced as to the procedure, the importance of the procedure. However, in a grown-up child, there may be feelings of that something is being done to them, and they may have feelings of getting violated, or that everything is not being shared with them. So they may take their time to get convinced about the importance of the procedure, and it is better not to hurry them into the procedure. So speak to them and convince them, and in general it is better that everybody's on the same platform and everybody wants to get it done for the betterment of the child. So when they're small, also the other thing is to the preparations that go into coming into the operation. Then so basically it's first of all is having the fitness test done, and the infection, etc. And then the next question that comes to the parents' mind is, what are the various things that we should bring together into the hospital when you're getting admitted? So certain comfort things, like if it's a small child, you can get his toys together, or if it's a little bigger one, if it's a bigger child, then you can have some articles like a blanket, or which is a favorite of the child, to come, and some relatives who are his favorite who can accompany him. The feeds, etc., formula feeds which can be brought in from home. So these are the various things that need to be done, preparation that need to be undertaken when a child is coming in for an operation. So that, in short, is the basic thing. And if you have any questions, you can go ahead with the questions, and I'll be happy to answer them. So the question is, how long does heart surgery take? So it's variable. Depending on the type of operation, it could be a short operation, could be just an hour. Generally, the minimum it takes is about an hour, and there could be longer operations. On an average, it's about 3 to 4 hours, and there could be some really complicated procedures which can go on for 5, 6, longer time also, but they are not that common. So before you get into an operation, you need to the child should be kept away from a source of infection. Like you keep him away from people who have some infection or cold, and not let him come in contact with these people so that he doesn't catch something, which can affect his recovery. If it's a grown-up person, we also deal with patients who have congenital heart disease who are grown up. So there should not be any, for a grown-up person, no alcohol intake, no smoking in general. That doesn't apply to children. But if you have a 20-year-old or a 30-year-old who's got a birth defect and needs operation, so that's relevant for them. And basically, that's basically what it is required to be avoided before operation. So once the child has had an operation, you can generally, when we get to operate on a child, get are taking somebody in for admission. Generally, we'll have the family go to the ICU and show them around the beds and all, and what to expect, where the child would be located after the operation. Generally, once the operation is over, I would have taken their phone number. I would call them, or somebody from the ICU would call them, and they come in, and so that it's not a shock to them, that there are other children lying around, somebody is on ventilator. So we tell them that the child will be on a ventilator after the operation, likely to be on a ventilator with a tube in his mouth connected to a ventilator. And then there will be tubes coming out of him, which are the drainage tubes, and there will be some IV lines, etc. And the child will most likely be asleep immediately following the surgery, and we will let the parents come in and see the baby and explain to them whatever the procedure was done and how it went. And then we will tell them that we would be explaining to them the progress morning and evening, and they can come and see the child once or twice a day, as depends on the rules in the ICU. And they can spend about 5 to 10 minutes inside the ICU while the child is still on the ventilator. But once the child gets off the ventilator, then they can sit with the child, and whenever the child wakes up or asks for them, they can come in and sit there with the child, and hold his hand and comfort him, so that the child gets to see people that he is familiar with after the operation. Once the once the surgery has been done for 1 or 2 days, then we start feeding the child. Initially, we start through feeding through the Reitz tube or a nasogastric tube, a tube which goes in through the nose into the stomach, and we feed them food in a liquid form, and then we start with semi-solids, and then we progress and then start oral feeding. By the time the child goes to the room, gets on to normal feeds. Pain medicines are given regularly. So one of the questions is that will he be having pain? Generally, pain is not a feature of post-operative recovery because they are adequately given analgesics. And but however, if they do feel that, we do ask them that are you feeling any discomfort, and extra medicines are given to them. The smaller the child, the less the pain, because the bodies are smaller, the movements are lesser. So the pain is generally a feature because when your bodies get bigger, and bigger children, once they're getting discharged from the hospital, we give them all the instructions as when to come back. Generally, we remove stitches on the 12th post-operative day. We call them back, get the stitches out if they are not already in the hospital. And then we tell them that they can have a bath about 3 days after the stitches are out. And then they come in for their follow-up visits. There should be no violent coughing. They keep both their hands on the chest when they cough. The lifting of the child should be like they keep the hands under the thigh or the bottom of the child, not lifting up by the arms, which may stretch the incision. And feeding should not be in excess, because I specifically tell the mothers that he's not going to grow in a day. So don't put extra feed into him. Give him just feeds that the child accepts voluntarily, and we will progress gradually from that, because the main fear after the operation is vomiting. And if a child vomits, the fear is that he may aspirate. That means the food stuff may go into his airways, and then it could become an emergency. So that situation we do not want after an operation. So these are basically the situations that we tell them. In general, after 1 or 2 months, they can go into their normal activity. They can go back to school in a month. If they are bigger children, they can start riding their bicycle after about 2 months, and lifting weights, like taking a school bag after 2 months. driving a car or a scooter maybe after 2 to 3 months, depending on when the sternum or the breastbone heals through which we have gone. So these are basic in general the advice that we give to the parents and what they have to expect after an operation. So pain is a like I said, pain. There isn't too much pain after operation because they're adequately covered by analgesics. The pain can be there in the smaller child. The pain is not that much. In bigger people, the pain can be there in the absence of pain medicines. So there would be pain about till about a week or 10 days after the procedure, or if you happen to cough violently, then you may have some discomfort. You may have some tightness of the chest is one of the complaints that lasts for some time. Actual pain generally goes away by the end of a week or two, or definitely by 10 days. So initially we start feeding through a tube which goes in through the nose into the stomach, and then we start semi-solids, or by bottle feeds we start feeding them little amounts. So partly by tube, partly by oral feeds, and then gradually the oral feed increases as they're able to tolerate feeds, and but they go on to solids. If the child is used to eating has teeth and is used to eating solid food, then just by about 4 to 5 days, he should be back to his normal diet. So prevention before operation, like I said, and we should avoid getting exposed to people may have infection or a cold. It should not should not venture out into the cold so that the child doesn't get catch anything that we don't want him to have for the operation, and the operation gets delayed because of that. Uh, just before operation, we want the child to be fasting for about 3 to 4 hours. So we tell them not to take anything for that duration before the operation, after he is admitted. And after the operation, the procedure, what we tell the child if he is little grown up is that when you wake up after the operation, don't get panicky because there'll be a tube in the mouth, and just lie quietly. We'll be there to explain to you what has happened, and we will explain to you that everything is okay. So you just lie quietly, don't panic, don't start pulling out things because that can make things difficult. Then we have to sedate you. Just try and shut your eyes and sleep, and the machine will be breathing for you, the ventilator. So just let the machine breathe for you. You just have to lie quiet. It's not easy. I'm sure. I have not been operated, but if somebody tells me to go through this, I'm sure if I find myself in that situation, it will not be that easy. But we try to explain to them because it is a necessary thing that they have to go through. And after operation, we will tell them that your mother and your father, your child parents will be there next to you. And once again, do not panic. Everything is under control, and very soon you're going to be back home. So these are the various things we try to prevent before and after the operation. So there are lots of conditions which can be a problem in the heart. When an open heart surgery in a child is a correction of defects which have come about through maldevelopment or abnormal development of the heart. The heart is a tube which develops when the tube curves around, and then it forms connections, and then it becomes into chambers and valves. So there could be different types of conditions, which could be anything that you can imagine. There are as many conditions which can be there as if you go underwater, and as the types of fish that you see there. So because there are variations in every condition that are known to exist. So you can have a chamber which is smaller than it should be. You can have a valve which is got narrowing. You can have a valve which is leaking. You can have holes between the two chambers of the heart. You can have abnormal connections. The vessels going out of the heart are coming out in an abnormal fashion, in a reversed fashion, or they may be half from one chamber, half from the other chamber. There could be combination of defects. like 2 3 different type of, your chambers may be inverted, your vessels may be inverted, your whole body's organs may be inverted. So it's a very interesting and complicated subject. But basically anything that is possible that you can imagine can be there. So thank you very much for your attention. And if you have any other questions, you can write to me on my email address, which would be provided to you. And thank you.